So, what medical conditions am I sending you for patients to see?
Okay, so um, developmental delays, including handwriting delay or gross motor delay, fine motor difficulties. We have feeding difficulties,
Okay.
sensory processing issues.
Yes. And what toys or equipment are you using to help my patients?
So we have a sensory body sock,
Ooh, fun. That looks
tweezers,
okay. Those are much bigger than my tweezers that I used to pluck my eyebrows.
and a scooter board.
Oh, fun! I want to play with the scooter board. And what environments are you able to see my patients in?
So in their natural environments, in the home, in the school, or maybe at a playground.
Okay, awesome. So, what do you do?
I'm a pediatric occupational therapist.
Yay! So, thank you for joining our game. I'm
Yes.
Dr. Lastra from Head2Toe Pediatrics, pediatrician, and we have Kara with us, and I cannot pronounce your last name, but she is an occupational therapist. So I'll let you do your introduction.
All right. So I'm Kara Mahelich of Fountain Pediatrics. I'm an occupational therapist and I specialize in sensory integration disorder. I've been practicing for 12 years and I have my master's degree in occupational therapy. So I have my practice here in South Tampa and St. Petersburg.
Awesome. Thank you.
Yeah.
So for our November topic, we're talking about babies. So let's talk about babies and how you help our babies.
Awesome. So I'm looking at their sensory functioning. It's part of their central nervous system. So I'm looking on how they take in their sensory information from their environment and how they process that. It really impacts the way that they interact with their world and how they engage. So when we think about our senses, we think about our five senses that we learned in school, like touch, taste, hearing, um, um, smell, and then we have also proprioceptive and vestibular input. So your proprioceptive sensory system is helping you to organize the information that comes into your muscles and joints. It helps you to understand where your body is in space, maybe without even looking at your hand, what you are doing with your arms and hands or legs. Also, your vestibular system helps you to process your movement and how you move around in your environment. So, for a baby that is rolling, crawling, rocking, so it's really important that we identify the moments where these babies are maybe seeking more of that input or avoiding some of it because it can really impact their development. An example I give is crawling. So if a baby is not changing their head position and they're keeping their head in midline, they might avoid getting in that all fours position, rocking baby pose, and continuing to crawl. They might just want to crawl up, pull up to stand on furniture, start cruising, get their balance, and then maybe they're walking early at 9 months old. And that's a common thing I hear when a child skips crawling is the parents might think, oh, they're a gross motor genius and they're walking early, but it's really important for OTs. Dr. Lastra didn't crawl, but look at her, she's thriving.
Okay.
It's just an important milestone because it can really help with hand development as we're bearing weight through the upper extremities. We're really building a lot of strength in the upper body and learning to use our extensor muscles in our back and our neck. So it's really something that can contribute to not having any difficulties or as much with fine motor or handwriting or postural control. So it's just an example of one milestone that I might be looking at thinking, why is the child not getting in this position? Is it something that's sensory based and can I help in that way?
Okay, no, that's an awesome description. It really helps.
Yeah.
I will say development is definitely something that I closely monitor. So I'm
Yes.
making sure they're checking off all of their milestones.
Mm-hmm.
Wasn't one that I would particularly worry about. I didn't crawl, but
Yeah.
really good to know that it's important for other things moving forward, because
Mhm.
definitely see when they're older, maybe not meeting certain milestones at that point and not really having related that to them not crawling.
Yeah. And it's important to know too, it's really not too late to crawl. So I might see a child who's 4 years old, 5 years old, learn that they didn't crawl, but we go back and incorporate that in our sessions. So we might be using the scooter board, getting in that prone position, crawling across the floor to do puzzles in tummy time. So it's something that we can always go back to.
Maybe I need to go see you and get some scooter board.
Just watch TV on your prone on elbows. Yeah.
Babies and kids like to do that like position for watching TV.
Yeah.
But I will say
Hmm.
that's definitely something that parents are always asking about, the crawling and things like that. So it's good to have a good resource and reference to send them to
Yeah.
those questions. And
Thank you.
yeah, with interesting with the what you mentioned with the proprioceptive and vestibular system, because I'm very accustomed to doing vestibular and proprioception exams for like athletes when they have concussions, where we test,
Mhm.
but
Yeah.
so with the babies, so it's something that
Yes.
I think
Yeah,
is
and that might look like a child who's maybe seeking more of that input, might be a clue to me, like, oh, they're functioning, they're not processing this information appropriately. So the baby might be rocking excessively, or maybe some head banging, or maybe some rough play, and you think, oh gosh, now they have a bruise on their head. They didn't really register that movement, that feeling. So it's something that gives me a clue. Okay, this is not being processed appropriately, and there are ways that we can help to neuro re-educate that sensory pathway and make it more appropriate and organized.
awesome.
Yeah.
Well, thank you so much for your tips,
Thank you.
for joining us in our Guess Who game.
Yeah.
I look forward to continuing to work together and helping our patients.
Me too. Thank
Awesome.
you.
Bye.
Bye.